More than 14.5 million Americans suffer from alcohol use disorder, which costs the United States more than $249 million each year, and each year this disease kills 95,000 people in the U.S. and over 3 million people worldwide. With the rise in alcohol-related deaths over the past 2 years and the urgent need to find accessible solutions, this has become a health crisis that isn't going away anytime soon. To talk more about this issue, I'm here today with Dr. Katie Witkiewitz, addictions researcher, psychologist, and regents professor at the University of New Mexico. Her research on alcohol addiction has focused a lot on harm reduction and providing evidence-based alternatives to the all-or-nothing treatment approaches. Katie, welcome. I'm so excited to be with you today.
Thanks, Tony. Thanks for having me. It's great to talk about this topic.
Fantastic. And I wanted to start off by asking you, with the incidence of alcohol use disorder having become so high in the US, how do you think it is that we got here?
Well, there's a lot of factors, right? And so first of all, as long as there have been humans on Earth, there have been ways to get high, and that includes with alcohol and other intoxicating plants. And so I think it's important to note that this is not a new problem, that people have been using alcohol for millennia for various reasons, for social reward, for relief of negative affect, for analgesic properties, pain relieving qualities of alcohol. And so alcohol has been widely used. Now, it's also really important to note that most people use alcohol without having problems. And so even though we know that there's no safe level of alcohol use, that alcohol is a toxic substance and a carcinogen and is associated with high risk of certain cancers. At the same time, most people use alcohol without problems and without health consequences. And so then we look at the small percentage of people who meet criteria for an alcohol use disorder, and that is increasing, and that's concerning. And I think in the last several years, we've seen an increase, particularly among certain groups, including women and older adults are the groups that have particularly shown a more dramatic increase in rates of alcohol use disorder. And then in the last 2 years, we've seen an increase with the pandemic, and all of the data across many different psychological and psychiatric disorders shows that distress is increased in the pandemic, and not surprisingly, people are increasingly turning to alcohol to cope with some of that distress, or have more time available to use alcohol, or for whatever reasons, more people are experiencing problems related to their alcohol use.
For sure. And so we know we have this huge problem now, and we know it needs to be addressed, but it just seems like there's so many obstacles for people who want to get help. And I noted there was a SAMHSA report that came out that said that 700,000 people who had alcohol use disorder and felt that they needed treatment weren't able to get the help they needed. And one of the most common reasons they gave was they didn't feel that there was a program out there that fit their needs. So why do you think, Katie, that the traditional 12-step model works for some people, but not as well for others?
Yeah, it's really interesting, because there is a lot of people who do really want help, but they don't want Alcoholics Anonymous or other 12-step approaches and in getting help. And I think there's a lot of reasons why people are looking for alternatives to that program. I think it's first important to note that, Alcoholics Anonymous and other 12-step approaches are really born out of a model of alcohol use disorder as a disease where the only cure is to never drink again. And there's not a lot of empirical data or scientific data to support that belief that it is the case that people with alcohol use disorder can never drink again. And so, I think a lot of people in our society are not looking for treatments with that view, that kind of, it's almost like it's this death sentence that if you have an alcohol use disorder, problems related to your drinking, that you can never drink again for the rest of your life. If you do drink again, you'll die. Mm-hmm. And that's kind of the mantra and messaging that comes out of Alcoholics Anonymous and other 12-step approaches. Now, I want to say that Alcoholics Anonymous and other 12-step approaches are really helpful for some people, and they're great programs. They're widely available great programs for some people, I should say, and widely available, and available online, and available, in most places in the world. But that said, a lot, like I mentioned, a lot of people are not looking to stop drinking altogether. A lot of people are looking to reduce their drinking or drink in less harmful ways, and so are really looking for programs that would support them in those goals. When we look at data from large surveys like the ones you mentioned, about half of people say that they don't get treatment because they don't want to stop drinking or they don't want to stop using drugs. And so we really need to be thinking about creating treatment programs that do address those needs and that do help people who aren't looking for the abstinence forever solution.
For sure. And I know also one of the other barriers that you've addressed in some of your research as well is stigma. And I think it continues to be a big issue for people. So can you tell me a bit about how that presents itself as one of the barriers for people who might want to take the first step in getting help?
Yeah, absolutely. Well, unfortunately, in our society, there's a huge stigma against all mental health disorders, including substance use disorders and alcohol use disorders. And that really comes from puritanical, moralistic views of these problems as kind of residing within an individual and being, characteristic of a moral failing or some sort of failing on the part of the individual, and not recognizing the complex biological, psychological, social, environmental factors that go into developing problems with alcohol and other substances. And so because there's there's kind of this circular stigma problem, the way I see it. So first, the 12-step tradition, the Alcoholics Anonymous tradition, has in some ways led to an increase in stigma by really focusing on the individual as needing to give up their willpower to their will to a higher power, that they are forever afflicted with this disease, that it is a disease that they are afflicted with, and that their only solution is to attend this particular program and attend Alcoholics, and attend Alcoholics Anonymous for the rest of their lives and be abstinent for the rest of their lives. So that all of those ideas present a lot of stigma, right? That this is a problem with the individual, that the individual is diseased and can never be a part of society with respect to a society that does prioritize drinking, and really creating this all or nothing or us versus them approach to alcohol use disorder. And in fact, it even says in the big book even talks about the fact that some people the big book of Alcoholics Anonymous talks about certain people being able to drink moderately, and the people who go to Alcoholics Anonymous are not those people. Right. And so really sets up this us versus them idea. And so that kind of creates more stigma, but then also creates media portrayals and creates beliefs in society that alcohol is a stigmatizing condition or is a stigmatized condition. And so that makes people not want to admit that they have a problem, not want to talk to someone about their problems with drinking, and really, creates more problems because then they delay help seeking even further. And so, I think a big problem in our society is this us versus them idea of alcohol use disorder, and not recognizing that alcohol use disorder actually exists on a continuum, with most people not actually having a very severe disorder at all. The majority of people with alcohol use disorder, about 65%, have what we would say is a mild disorder. They only meet a few symptoms of the disorder, are likely able to reduce their drinking and improve their quality of life and improve their health and functioning, and may be able to continue drinking and be successful with harm reduction as a strategy.
And with this, widely held belief that abstinence is the only long-term solution for alcohol use disorder, when you talk to people, how do you address this, and what does your research say about harm reduction?
Yeah, so what we found is that abstinence does work great for some people, and so I also like to talk about abstinence as part of harm reduction. And anytime I talk to someone who's interested in changing their drinking behavior or has questions about alcohol use or alcohol use disorder, I always talk about abstinence as one potential solution that works really well for some people. And it's also not a solution that works well for everyone. And what we know is that people who reduce their drinking, who make substantial reductions in their drinking, tend to have health outcomes that are very similar to abstainers, seem to be functioning as well as abstainers. Our research shows that they're able to maintain drinking reductions for up to 10 years following a change attempt, and that even short of even not getting to total abstinence, you can still have reduction in alcohol dependent symptoms, alcohol use disorder symptoms, reduction in harm that alcohol causes. And so I really see it as there's a multitude of options that people have. There's not one, and I think we also think about harm reduction as a step towards abstinence, or a step towards making the decision to be abstinent, because a lot of people will end up finding that they don't like alcohol as much once they start reducing it. They don't like the effects it has on them. They notice that more, and they might ultimately decide to stop drinking. But we like to present that you have a menu of options of different goals, and helping people kind of identify which goal fits best for them.
And you talked a bit about one of the outcomes being that people were able to reduce their level of drinking over a period of time. I think you even said 10 years, which is significant. And in your review of harm reduction programs, so to get to these places of success, what are some of the other key factors that need to be in place, would you say, in a program that lead to successful outcomes? Like, what does that look like in terms of the level of support or accountability or psychosocial support, that sort of thing?
Yeah, it's really, we know a lot about what helps people change. And what we know about what helps people change is first their own commitment to want to change. Obviously, that there has to be, some desire to change behavior, just like any health behavior change, right? Like you wouldn't expect someone to magically be successful with a diet if they didn't like decide that they wanted to diet, right? So we would expect first an initial commitment to change, some desire to change. And then support around the person for that change. So some support from friends or family members, even people that an individual might drink with, to actually kind of have that support to make those changes, and be a cheerleader, if you will, for the person in making those changes. We also know that professional supports can be really important. So this could be medications from a primary care provider. There's online resources, there's apps, there's lots of different professional types of support that could be available for people, and that are quite successful in helping individuals reduce their drinking. Even just tracking how much you drink can be really helpful to reduce drinking as a first step. We then know that people's success in changing their drinking is really helpful in predicting more success with changing your drinking. Obviously, you want to have those experiences of doing well.
Yeah, so like those baby steps almost, so they see a little bit of progress, and then it spurs them on to have more success and keep going even through the hard times.
Absolutely. And it's, what we always encourage is setting achievable goals. And so those could be, when we treat people clinically at our clinic, those might be setting goals for how many days a week you're going to drink, or how many drinks you're going to have when you do drink, what's your maximum drinking day going to be, what's your typical drinking day going to be, and really setting those concrete specific goals, but that are achievable and that you feel comfortable that you can achieve them. And then seeing the progress in achieving those goals. And also, any health behavior change is hard. So also recognizing that there are going to be times when you might exceed the goal, or you might not meet your goal, and that's okay, that you're going to stay on the track of, being committed to the change in the long term, even if there are, there's some instances of not meeting the goal every day. Another piece that we find is really important is having alternative activities. So it's kind of like you can't take something out of someone's life and not put something in its place.
Right.
And so, having substance-free activities or alcohol-free activities that are enjoyable to the person, that they can make time for now that they might be drinking less, and also kind of continuing to engage in activities that maybe were previously paired with drinking, and experience them without paired with drinking, and see how they like that activity as well. So really kind of creating an environment that is supportive of the change. And that includes, again, substituting, non-alcohol alternatives occasionally, or substituting alcohol-free activities into daily living.
Yeah. And just like on a side note, we've noticed such a rise in the non-alcoholic beverages as well. And I just wanted to ask you, do you think this could be one of those substitutes, and have you seen how these work as well?
Yeah, no, I think it's great. I think it's great that there's an increase in non-alcohol alternatives that are kind of treats, because I think a lot of people come to associate alcohol with reward and congratulations and, parties and all of these things, that it's kind of like I said, like a treat or reward. And so the idea that there would be, like, finally like good tasting, like fun, marketed non-alcohol alternatives. And I think that does a couple of things. One, it helps people kind of have a replacement that feels like somewhat nourishing and rewarding. But it also helps people feel less out of place if they're not drinking alcohol, that they're drinking this other beverage that kind of looks like an alcohol beverage. And so I think that can be really helpful too.
Absolutely. And before we finish up here, I just wanted to mention one more thing. And you probably, of this already, but in April, the NIAAA revised their definition of recovery to include harm reduction, which is a huge step. So it's not just based on abstinence or the reduction in days of drinking. So Katie, can you explain why this is so important?
Absolutely. Yeah, this is a great move from the National Institute on Alcohol Abuse and Alcoholism, as well as a similar recent trend from the Substance Abuse and Mental Health Services Administration, to start recognizing that recovery includes multiple pathways and does not necessarily mean abstinence. And this is really important because it's empirically supported. So the science shows that many people recover from alcohol and other substance use disorders without achieving abstinence, but they have really good functioning and really good quality of life. And that also, there's kind of the flip side of people who might be successful in achieving abstinence, but don't actually have good quality of life or good well-being. And so what this move is doing is prioritizing that there's more to recovery than how much alcohol or drugs you consume, and that it's really about that you're functioning well in life and experiencing good quality of life, and that it recognizes and acknowledges that you could have good quality of life and improvements in well-being without achieving abstinence, and maybe still having drinks occasionally, or still using, an opioid medication, or still using cannabis, or still smoking cigarettes, that you could still engage in some substance use and experience recovery of life and well-being.
For sure. And hopefully this takes us more along the road to reducing stigma as well around that, because it opens that up.
Absolutely.
For a different definition of success and recovery.
Yeah.
Yeah. So thank you so much for being with us today. It's really been enlightening, and to talk a bit more about harm reduction. It gives me a lot of hope, and yeah, I hope you have a great rest of your day.
Excellent. Thank you so much for having me.